terapia de ozônio no tratamento da disfunção mitocondrial em doenças psiquiátricas e neurodegenerativas.
Thank you very much for the introduction. After Chinese language, if I can't, I want to speak in Romanian language. It's just joking. It's an honor for me to be here, and I want to tell you that I have a great emotion. Delegates of doctors from Romania and Moldavia, thank you for the invitation and the hospitality. I congratulate Mr. President, Dr. Antonio Teixeira, my friend, Romanian friends, and his team for this Congress. And I like we made a good choice, but nominating him for this position last 2 years when he was in Bucharest. Honored audience, dear colleagues, my presentation is interesting one and his challenge for me as present. The Romanian Scientific Society of Oxygen-Ozone Therapy is concerned with the therapeutic benefits of oxygen-ozone therapy in the control of mitochondrial dysfunction and oxidative stress cellular mechanism that, in our opinion, underlie neurodegenerative disorder. The results of current psychopharmacological treatment have limited clinical outcome, falling short of initial estimate and enthusiasm, overemphasizing neurobiochemical mechanism and downplaying cellular mechanism seems to be scientifically correlated with poor therapeutic results like therapeutic inadequacy, therapeutic resistance, or incomplete remission, adverse effects, early discontinuance of therapy. Neglecting the importance of complementary therapies, O3 is overestimating neurobiochemical mechanism and underestimating cellular mechanism. Excessive cost increase in depressive disorder based on meta-analysis. Higher cost in adolescents, in elderly and comorbid depression, which are risk factors for Alzheimer's disease. Very high cost reported in 2020 and their annual increase by 15 to 94%. In our point of view, Alzheimer's disease has a very high potential for growth after the COVID pandemic, which we will present further during the paper, which is why the importance of preventive therapeutic attitude increase, and we will emphasize the potential measure role of the ozone therapy. Next, we will emphasize the presentation of cellular type, mechanism, mitochondrial dysfunction, and oxidative stress that can be combated by oxygen-ozone therapy. The central role the mitochondria play in the pathophysiology of psychiatric disorders, as mitochondria control neurogenesis, synaptogenesis, and synaptic plasticity, as well as the release of ATP. Mitochondrial dysfunction annihilate the mechanism of synaptogenesis and plasticity, mechanisms that can be amplified by the increase of oxidative stress, ROS, and excessive calcium ion release at extracellular level, a phenomenon of affects synaptic signaling in neuronal chains, occurring the phenomenon of disconnectivity, signal interruption. Disconnectivity leads to a massive relief of protein kinase C and nuclear factor KB, which are indirect marker of the intensity of disconnectivity. The lack of therapeutic intervention to rebalance mitochondrial functionally and decrease oxidative stress alters nuclear transcription factor, which in turn amplify the decrease in synaptic plasticity, creating a vicious cycle. Mitochondrial dysfunction is determined or amplified by the increase of cellular, extracellular calcium ion levels, which favors the release of glutamate and triggering the phenomenon of excitotoxicity, which under the condition of glutathione depletion destroy mitochondrial membrane. The effect of altering the nuclear transcription elements disrupts electron transport, the functional energy support of the organelle. Mitochondrial structure reacts bidirectionally with ROS. Mitochondria amplify ROS and ROS amplify mitochondrial dysfunction. Mitochondrial dysfunction inhibits ion pumps, both the brain and in the other organs, especially in the heart, favoring severe rhythm disturbances. The decrease of adenosine triphosphate, which is the most important secondary messenger in the brain biochemical synapses, causes intrasynaptic disconnectivity. Mitochondria increase oxidative stress and apoptosis. All these mechanisms may act synergistically and underlie most psychiatric disorder. Dysfunctional mitochondria are characterized by membrane rupture, and results is a bioenergetic failure marked by excessive increase in cellular oxidative stress, decreased neuronal signaling, neuroplasticity, and neurobiochemical transmission. The excessive increase of ROS is an important marker confirming mitochondrial dysfunction of the lesional irreversible type and confirming the alteration of mitochondrial respiration. The destructive effect of oxidative stress is favored by synergistic pathogenic relationship with mitochondrial dysfunction and is based on the functional imbalance of neuronal cells with alteration of mitochondrial DNA and causing premature senescence neuronal cells, apoptosis and dysplasticity, but also increased permeability of the blood-brain barrier and inflammatory process, mechanism underlying neurodegenerative phenomena. We focus on depression because it is the main risk factor for the both mitochondrial dysfunction and neurodegenerative disease. Mitochondria and mood, mitochondrial dysfunction as a key player in the manifestation of depression. Comparison between mitochondrial function under normal condition and change in depression, emphasizing the pro-inflammatory activity, apoptotic mechanism, and alterated synaptic plasticity that may be altered, and the therapeutic inadequacy of antidepressant treatments in depression. Antidepressant drug therapy may be ineffective, in particular by marked decrease in the mitochondrial adenosine triphosphate dysfunction in the honest of intrasynaptic disconnectivity. Depression and SARS-CoV-2 increase risk for neurodegenerative and Alzheimer's disease. Depression as a risk factor in Alzheimer's disease. The risk of Alzheimer's disease increase in depression comorbid with diabetes or in a presence of severe dyslipidemia. Mechanism of mitochondrial dysfunction, its elderly people are favored by COVID-19 infection, which causes mitochondrial pathology, increasing oxidative and pro-inflammatory phenomena, immunosenescence and inability to respond completely to viral aggression. In fact, COVID infection and especially the analysis of post-COVID symptoms confirm the increased incidence of depression, bipolar disorder, psychosis, epilepsy, and Alzheimer's diseases. All patients who have undergone severe form of COVID-19 are at risk of pulmonary and cardiac fibrosis and impaired renal function. At the base of the mechanism of degenerative dementia disorder, including Alzheimer's disease, in the alteration of the functional structures of the hippocampus, the main neurobiological elements of cognitive circuitry. Aggression of the hippocampus can be direct caused by the SARS-CoV-2, but also by increased neuroinflammatory phenomena and oxidative stress or altered neurogenesis phenomena obviously associated with mitochondrial dysfunction. In these circumstances, ozone therapy takes on a particular dimension in the prevention or treatment of cognitive dysfunction in Alzheimer's disease and other neurodegenerative processes. For the proper functioning of the neuronal structure of the brain, the energy and metabolic contribution of astroglia is mandatory. In fact, we can talk about tripartite synapses in which there are pre- and post-synaptic neuronal structure, astroglial structure, and vascular structure. The alteration of vascular structure is favored by depression, mitochondrial dysfunction, and oxidative stress, and causes alteration of the endothelium of small cerebral vessel that can be objectified neuroimaging, but the presence of hyperintensity of white matter. White matter hyperintensity neurodegenerative risk factor. You can see in the photos number 1 to the left. Punctiform and perivascular lesion in the middle photos. Increase in hyperintensity volume both at the level of brain mass and the presence of periventricular leukomalacia that favor the development of ventriculomegaly. And the last one, main indicator of alteration of the subventricular and periventricular granular area, the generate neuroplasticity. The dynamic of white matter lesion progression is the first argument for the early use oxygen-ozone therapy and antioxidant therapy in Alzheimer's disease. Early prevention and the use of oxygen-ozone therapy is also confirmed by the presence of beta-amyloid deposit in the MCI stage of Alzheimer's disease, there being in the phase 2 lesional stage with beta-amyloid MCI1 little deposit, so that in MCI2 are massive, the cerebral lesional change are not consistent with cognitive deterioration. Usually, the first effective therapeutic intervention in Alzheimer's disease is related and the distance between the loss of self-care skills and cognitive deterioration requiring hospitalization is in a nursing home in about 2 years. In contrast, on a computerized model evaluating the efficacy of early intervention from the first symptoms of the disease, the distance to nursing home placement increased to more than 10 years, which justify the possible benefits of oxygen-ozone therapy. Mitochondrial dysfunction and damage to its membrane, as well as excessive increase of free radicals, can also be signaled by a peripheral blood marker, based on which the benefit of this therapy can monitor it. The base of cognitive deterioration in Alzheimer's disease is correlated with the progression of hippocampal atrophy, and the dynamic assessment of this change confirm that about 5 years, the period of transition from minimal hippocampal lesion to Alzheimer's disease itself. The accuracy of this neuroimaging marker is about 90%. The study carried out by our team on animal model, rats, highlights the important hippocampal lesions induced by haloperidol, an antipsychotic commonly used in the control of behavior disorders in the elderly. The significant hippocampal lesion highlights the risk of precipitating cognitive deterioration and progression of neurodegenerative elements. The association of dexamethasone with haloperidol, the model of activation of the HPA axis specific for depression, show a major lesion after 3 and 7 days, respectively, of the hippocampal structure, confirming on animal model that depressive disorder, confirming its a major risk factor for cognitive impairment and cellular dysfunction and intense oxidative stress. The benefits of oxygen-ozone therapy in the elderly are justified by the fact that it improves mitochondrial dysfunction, decreases oxidative stress and apoptosis, and increases ATP production in mitochondria. It also decreases inflammation and oxidative stress, improving cognitive quality. The antioxidant defense mechanism can be evaluated by increasing the enzymatic activity superoxide dismutase and glutathione peroxidase. The use of oxygen-ozone therapy amplifies the antioxidant defense and preventing mitochondrial damage. The role of NRF2 in the antioxidant cellular response to medical ozone exposure. Administration of oxygen monotherapy balance, homeostasis and activation of NRF2 at the level of the nuclear structure that amplify the gene expression of the transcription factor antioxidant response element. In turn, it improves mitochondrial function and rebalance the quality of cellular proteins, restoring their homeostasis. All these mechanisms lead to a decrease in oxidative stress and inflammation mechanism to elevate a whole range of somatic disorder based on mitochondrial dysfunction, such as diabetes, cancer, aging, and ischemia. Ozone therapy has an obvious neuroprotective potential on the hippocampus, as demonstrated by the study of Professor Frank Hernandez, Lamberto Re, Silvia Mendez is here, in which rotenone was used as a neurodestructive element and O3 was administered concomitantly at the same level with promising results. You can see in the figure number 5 normal control image, figure number 6 in rats treated with rotenone alone, perivascular edema and cariolysis and cell necrosis evidenced by a row are observed. Figure number 7, the concomitant administration of rotenone with ozone show a quasi-normal picture, and number 8, in rats administered only ozone, a normal structure without pathological changes observed. And now, dear colleagues, conclusion. Aging and neurodegenerative diseases are characterized by complex and multifactorial etiology and challenges regarding treatments, efficacy, and cost persist. Oxygen-ozone therapy is a non-invasive, non-pharmacological, low-cost and no side effect procedure based on antioxidants capacity of O3. A plethora of scientific evidence supports other crucial properties of O3 in physiopathological processes. NRF2 is one of the principal molecular signaling on which O3 exercise its antioxidant, anti-apoptotic, pro-autophagy effects involved in aging and in neurodegenerative disorders. The review provides a consistent, rational implement future clinical studies to apply to O2-O3 treatment along with other antioxidants, polyphenol, mushrooms, glutathione, in aging and in neurodegeneration. Now, our team at University of Medicine and Pharmacy of CRAIOVA working in the experimental field on animal model of the possible benefits of oxygen-ozone therapy has prepared and hopes to start this year 2 projects. The study of the neuroprotective effect of oxygen-ozone therapy in cognitive disorder or Alzheimer's disease is the first, and the second project aim to find valid biomarker for the objectivation of mitochondrial dysfunction in depressive disorder. And the last, the legislation of ozone therapy in Romania, it's a big success. It's not my success, it's our success, society success. In February 2024, ozone therapy was officially recognized as a complementary medicine specialty. Medical specialists who want to practice this therapy have to follow the attestation course organized at the University of Medicine and Pharmacy. The courses are organized with the direct involvement of the Romanian Scientific Society of Oxygen-Ozone Therapy. After passing the national attestation exam in ozone therapy, doctors have registered a certificate of free medical practice and this specialty. Thus, from a legal point of view, ozone therapy become like any other specialty, acupuncture, ultrasound, etc. This attestation has also made it possible for ozone therapy medical services to be partially introduced in the state hospital units and to be partially reimbursed by the National Insurance Service. To the best of our knowledge, this way of certifying the specialty of ozone therapy is the first in Europe and can be taken as jurisprudence by the other EU member states. Romanian Scientific Society of Oxygen-Ozone Therapy aim to promoting a national educational program on psychopharmacotherapy addressed to physicians of all specialty and psychotherapist clinicians on the benefits of oxygen therapy in the treatment of patients with multiple comorbidities in which drug therapy cannot be used due to the major risk of severe adverse effect. Thank you very much for your attention.